In this video, we will present the 2022 through 2027 Illinois Comprehensive Cancer Control Plan's Diagnosis, Treatment, and Survivorship section. This is the IDPH vision and mission statements. The 2022 through 2027 Illinois Comprehensive Cancer Control Plan is available to view and download on the IDPH website at the link shown here. In this presentation, we will review the diagnosis, treatment, and survivorship goals, objectives, and strategies. The diagnosis, treatment, and survivorship section is on pages 27 through 33 of the cancer plan. Diagnosis, treatment, and survivorship includes providing support and services to patients, survivors, and their caregivers to address social, emotional, and financial challenges they may face. The first diagnosis, treatment, and survivorship goal is to promote awareness and access to navigation services, including financial navigation and care navigation, to reduce disparities in cancer health outcomes. There are two objectives for this goal. The first objective is to promote 4 educational opportunities for patient navigators per year. This will be measured by the distribution of patient navigator educational opportunities per year. The second objective is to develop a resource document of supportive services. Objective 2 will be measured by the completion and distribution of the resource document. The second goal for diagnosis, treatment, and survivorship is to increase the diagnosis of high-risk patients with familial or genetic risk factors. There are two objectives for this goal. The first objective is to improve awareness of guidelines for surveillance diagnosis and appropriate treatment. The final objective is to increase the number of referrals to genetic testing. Goal 3 is to increase the awareness of ongoing care coordination for monitoring, follow-up, and recurrent screening. There are 3 objectives for this goal. The first objective is raising awareness among healthcare providers of surveillance and follow-up guidelines, which will be measured by the promotion of guidelines to 4 organizations with healthcare providers. The second objective is the promotion of existing resources that can be shared with different associations to educate healthcare providers on the elements of navigation. This will be measured by the identification of 5 associations each year to distribute different measures to their constituency. The final objective for Goal 3 is to increase patient and provider awareness of survivorship care coordination and guidelines by directing patients and providers to survivorship resources. This will be measured by the distribution of materials to at least 5 patient advocacy organizations per year. The fourth goal is raising awareness of the need for increased quality of life, for enhanced recovery and survivorship, and available resources. All data for the first 4 objectives is from the Illinois Behavioral Risk Factor Surveillance System. The first 2 objectives are focused on decreasing the number of days a cancer patient or survivor has had poor mental health or their health kept them from doing their usual activities. A third objective is focused on decreasing the percentage of cancer patients and survivors who are overweight or obese to 10.2%. The fourth objective is decreasing the percentage of cancer patients and survivors who binge drink alcohol to 4.3%. These are the last 2 objectives for Goal 4. The fourth objective is the promotion of clinical trials to current cancer patients. This objective will be measured by the promotion of clinical trials in 2 educational documents each year. The final objective is to increase the number of Illinois providers that are certified in hospice and palliative medicine to 228. The final goal for diagnosis, treatment, and survivorship is to support the availability of telehealth and outreach programs. There are two objectives for this goal. The first objective is the promotion of the continued availability of telehealth for patients. The second objective is to promote educating patients on how to utilize telehealth platforms and other technology. This objective will be measured on the availability or curriculum or training resources for clinical staff and CBOs to support the patient use of telehealth platforms. The strategies are divided into different areas of focus of policy, health systems, environmental changes, and health equity. Each objective has a list of policy, health systems, environmental changes, and health equity strategies. Here is an example of each type of strategy in the diagnosis, treatment, and survivorship section. People have several different options to address diagnosis, treatment, and survivorship. Individuals can share knowledge and medical history with family members. Community organizations can provide or host cancer support groups. Schools can provide counseling services for students and caregivers going through cancer treatment, whereas employers can help support cancer survivorships in the workplace. Healthcare professionals can provide adequate services and navigators for survivors and caregivers. Insurance and policymakers can support legislation that funds cancer treatment. If you have any questions, please feel free to contact the Illinois Comprehensive Cancer Control Program at dph.compcancer@illinois.gov.